I am Dr. Sadanand Shetty from KJ Somaya Hospital and Research Center and Somaya Super Speciality Hospital. I am a senior cardiologist in this institute. I am here to give you basic information about the heart health on the occasion of the World Heart Day. As we all know, World Heart Day is celebrated on 29th September every year, and World Federation keep one theme every year to create an awareness about the heart diseases. So also this year the theme is Don't Miss a Beat, which basically means that we should not be ignoring the heart health. We have to take necessary action to prevent the heart disease, and we have to prioritize our health, in particularly for the heart related illnesses. As you all know, one of the most important reasons why heart disease are on the increase more so currently is because of the lifestyle factors which affects every individual, particularly the younger generation. The stress, particularly the mental stress, and so also the habit of eating, not taking regular walk, and taking junk food, and taking tobacco and doing smoking, etc., are the common reason why we get these diseases. So also the sleep is very important for the people to prevent or to minimize the effect of sleep related issues for the heart. When we talk about this awareness on this World Heart Day, we essentially means you have to take care of your heart diseases, particularly whenever we get any symptoms related to this illness. We have to take action, we have to approach, and we have to come to the institute or the hospital to take necessary action. Very important thing in prevention is whether we are suffering from diabetes, hypertension, or dyslipidemia, that means high cholesterol. Taking these lifestyle diseases very critically, taking care of blood pressure, diabetes, dyslipidemia very aggressively right from the young age will make a long way in real prevention of heart-related diseases, particularly the coronary heart disease. In simple term, we call it as a myocardial infarction. Most important thing in case of heart health is doing the regular walk at least 30 minutes per day, 5 days a week, and taking balanced diet to see weight, not to indulge in fast food. Once in a while is fine. Avoiding smoking and tobacco related products, and whenever illness like hypertension, diabetes exist, we have to take measure of this particular the medication. Currently, according to me, we can easily prevent heart diseases and diseases related to these three lifestyle diseases like heart failure, stroke, renal failure, etc. Younger people in particular should be very cautious, in particular when we have a strong family history. So at the age of say 18 to 20 years, maybe when we enter the college, is a time for one to check their blood pressure, check their sugar status and the cholesterol status. More so in people who have got a sedentary lifestyle, who are obese, and who have got a strong family history, they have to be more cautious, and we have to pick up this illness very early. Many times people are suffering at a young age, but the action is never taken, and by the age of 30, 35, 40 years, the complication related to these three lifestyle diseases occurs, and suddenly patient gets a myocardial infarction, that is heart attack. We must believe, and according to me, that heart attack doesn't occur just overnight, in just in a day or a few days. It does give some warning signal to the person, but people are careless about it. They're more into career-oriented work and not bothered about the health. And many times these heart-related diseases are silent. In the sense, it may not give symptoms in the beginning, but when it gives symptoms, we have to immediately take action and we have to approach hospital, we have to do the necessary checkup and we have to take necessary action. To me, today the progress is so much in this heart health and heart related diseases. Like an institute like us, we have an emergency service round the clock 24/7. Any acute chest pain, whenever they get, they can attend the casualty emergency room and necessary action can be taken immediately. Very importantly, the symptoms which are suggestive of heart disease like a heart attack should be recognized early. That early recognition is very important. Many times patients spend or waste time and they attend hospital very late. By that time, complication of the heart attack occurs. Their heart pump weakens, the heartbeat goes very fast, and then whatever we do intervention like doing angiogram, doing angioplasty, bypass, etc., is the results are not that good. Unlike when patient attends in time. So my important message on this particular day: don't miss a beat. Means you should be aware of the heart health. We have to take necessary action to keep heart health. It is one's own responsibility to keep heart healthy, like whatever methods I mentioned. So prioritize your health, particularly when we have this heart health, and take necessary medication, drugs, and not only taking drugs but effectively controlling blood pressure, controlling blood sugar, and the cholesterol level is very, very important, because just taking pill and if these three illnesses are not under control, again the treatment is not complete. And this is what is the main the suggestion or information I want to give to the people who are listening to me and all the people concerned in this area. Friends, one more important information regarding the exercise I want to communicate here. Many times we observe in younger people taking very intensive exercise in the gym, taking high protein and the hormonal medication, which is not advisable. Normally, whenever we talk about the exercise for the heart fitness, it is the exercise which is giving enough oxygen and the maintaining the heart health. Therefore, brisk walk, cycling, swimming, what is called as the isotonic exercises are recommended. 2 days in a week, resistant exercises are recommended, wherein people can take little extra weight and they can do the isometric like exercises. So essentially, people who are suffering with the heart disease, taking heavy intensive exercise, using these various preparations are not available. Since we do see occasional cases whenever they do high intensive exercise or during taking this exercise, suddenly they get heart attack and sudden death, which are basically because of the exercise is beyond what heart can take up, and suddenly the arteries having coronary plaques, which is atheroma, suddenly giving way and rupturing and giving rise to sudden death and maybe heart attack. So my recommendation here, not to take very high intensive exercises, gymming with very heavy weight, particularly people who are suffering, and taking these high protein and the hormonal therapy are unphysiological. So we recommend exercise for the heart health which are physiological, as I mentioned. Thank you.